ending 1 minute at a time.
I was blind, but now I see.
Working jobs we hate, so we can buy shit we don't need.
Ideas are brittle.
If you had one shot, everything I'd ever read, heard, seen was now organized and available.
Now you fucking khakis.
Life moves pretty fast.
The Biohacking Secrets Show.
Jennifer and Andy, welcome to the Biohacking Secrets Show.
Thank you, Anthony, for actually having us on the Biohacking Secrets Show.
Thank you.
I have this futuristic device on my wrist right now that is made by a company, Weber Medical, that you guys both work with. And it's called the Spectra Watch. And it's got a red, yellow, blue, and green light shining into my wrist. Maybe you guys could start out by explaining to our listeners, what is PDT or photodynamic therapy? And then after you've explained that, how you guys both got into this fascinating space.
Absolutely. Well, PDT specifically is basically utilizing certain wavelengths or mechanisms of light to affect the human body, right? So if we go out into sunlight, it has a full spectrum of light spectrum, yellow, green, infrared, red, blue per se. So the concept of low-level laser therapy or photodynamic therapy is, unlike lasers that destroy tissues and cells, we're using low-level laser therapy, meaning that these are medical laser therapy applications that each color develops different effects, which are invoked by the stimulation of specific cellular components in the body. So what we're looking to do is give light therapy with specific wavelengths and colors of light versus scientific methods to apply to the human body to stimulate healing processes, ATP production, mitochondrial, to support the immune system. Every color of light or spectrum affects something different in the body. And this has been studied for years in different scientific applications, as well as physics studies looking into immunotherapy to regenerative medicine across the board. So photodynamic therapy in all is a way to give the body back cellular energy for regenerative immune therapy. There's so many different applications of it. I can kind of take it further. I think Andy can also, she's quite articulate in this field, that can give a little bit of an explanation on that one too, and kind of support me in that one. Andy, would you share your concept of that?
Yeah, another piece that I often think about is just how communication is happening within your cell structure, within the tissue structures. And one of the unique things about laser is that it's coherent. It's very organized. It's very structured. So we know that it delivers information both to whatever it's being shown on as well as back. It's biphasic. So it goes to the person and back to whoever, whatever's being held onto it. And when you couple that with what we call photosensitizers, those are different nutrients, different substances, whether it's alpha lipoic acid or a curcumin or a nanoized like green tea extract. Those are almost, I think of it like if you have a crystal in the window and you shine light on that crystal, it'll throw rainbows across the different walls of that room. That's a little bit what the laser's doing inside of your cell structure as well. And so it's been super fun to play with. And, we all know the more we delve into research and the more we delve into physics, we know that things happen in the body much faster than could be explained by electricity. So we know that light is a very important messenger molecule within our cell structure. Fritz Albert Popp is one of our awesome, professors out in Germany that's done some fantastic studies with this. And so it's a way of helping your body return to its optimal function by giving it the correct messages that entrain it.
Yeah. And I think it's fascinating that we have this entire rainbow of colors, this Roy G. Biv, the red, orange, yellow, green, blue, indigo, violet. I think I might have learned that in Sesame Street growing up. And how this invisible rainbow is present in sunlight. But I think a lot of biohackers are now recognizing the benefits of bringing infrared light and red light into their home. And we've done some other podcasts about that, talking about, as you mentioned, mitochondrial health, decreasing inflammation, accelerating recovery, increasing oxygen utilization. You guys will actually get a kick out of this story. Jennifer, we've talked a bunch offline, but I haven't shared this. Like, part of my journey, and your journey too, Jennifer, maybe yours, Andy, I don't know. We'll find out, was Lyme disease. And I had come across in 2015 something that I included in the original copy of the Biohacker's Guide to Upgraded Energy and Focus, which was the UVLRX. It was this intravenous light therapy device that contained, I believe, and feel free to correct me if I'm wrong, red, green, and purple wavelengths. And like over a 1 hour session or so, you'd get all three wavelengths. And I got the idea during one of those early sessions to try and do breath work during it, because I wanted to see how my breath hold times compared to, like when I'm doing it, just say outside. How did they compare when I was using intravenous light therapy? And was there a noticeable improvement? Not only was there a noticeable improvement, there was a substantial improvement. Like, I got my first 5-minute breath hold time with a light IV in my arm. That company got a ton of stuff from certain acronyms that everyone's familiar with, that sort of pushed them into a difficult financial position. But that's part of why I got so excited when I came across what you guys are doing, because this stuff works and has, just huge applications. Let's go beyond red. What does the the blue, the green, the yellow frequencies, what are the benefits of some of these different colors that are being shown into my wrist, into my radial and ulnar arteries right now? What are some of those benefits in the body? And why are they included in your products?
Well, you're referring specifically to the little laser watch you're using on your wrist at the moment?
Sure. Because we've got the yellow, the blue, and the green in here. This goes beyond just red light therapy and some of those.
Of course.
So what are some of those benefits?
Well, there have been extensive studies on those. So, if we look at yellow light, just as an example there's been studies shown that yellow assists with the production of serotonin, dopamine, vitamin D. We even have clients and patients we work with that no matter what they do with vitamin D supplements, they're just not absorbing. Mm-hmm. So, of course, one of the best things would be tell people, go outside, get some sunlight, right? But everyone tells people these days, why would you go outside? Put sunscreen on, protect yourself, which we understand. But the truth is, if you spend 5-10 minutes a day out in the sun, your vitamin D levels are going to increase exponentially, right? Mm-hmm. With yellow laser or yellow light, it does increase the cellular function to stimulate your own production of vitamin D. So that's one. Serotonin, dopamine. Yellow has been shown to increase detoxification support and detox pathways. It's been shown to help with viral and chronic bacterial infections as well. Any light therapy, any color or spectrum of color will assist with bacterial, viral, because we're enhancing the cellular function of the body, as even Nurse Andi there was saying too. So we have vitamin D, we have tissue and immune defense prevention of infections. It increases and improves serotonin. And then we go into, we're talking about red specifically, right? Red and infrared. And we have a great little chart we can explain on that. But if we go to blue and ultraviolet are some of the best two colors for viral infections, bacterial infections. The physiology of blue also works very well in bloodstream or absorbed even sometimes by skin with some of the porphyrins and hemoglobin. So it increases nitric oxide in the body as well, or produces and improves microcirculation and oxygen uptake. Green is kind of along those lines too. So we have a strong absorption of green introduced into the body by assisting with also stimulation of sodium and potassium pump in the body. So green, in addition to having wonderful effects on acute inflammation, we're also having much better effects with defense mechanisms and stimulating per se, or stimulating the immune system function for absorption. So one of the tricks with light therapy are photosensitizers. Most people will go and use any kind of light therapy, but I think biohackers out there are going to hear this pretty well. What is the one thing we hear from some of our doctors in traditional field, right? We're stepping outside of even integrative and holistic medicine. Just look at pure traditional. They tell you if a patient goes in and receives a chemotherapy, they tell you to some chemotherapies, they tell you to stay out of the sun for so many hours, right? We've all heard that. Or certain antibiotics or medications, they say, oh, this is a photosensitizer. So you need to be careful of going out in the sun for specific amounts of time. Well, there are herbs, drugs, medications, supplements that will make your body, your receptors, your cell receptors more sensitive, specific spectrums of light. And there are devices out there that can measure the spectrometry of certain natural agents and make you more sensitive or absorbing. Curcumin's one of them, green tea extract's another, chlorophyll's another, vitamin C, artesunate, frankincense even, CBDs as well. And then we can go into the more traditional round of even certain, traditional medications, antibiotics, chemotherapies, the same thing. So one thing we've done with using different spectrums of light, green, yellow, infrared, ultraviolet, any of these, blue, is we can integrate a natural agent to match more of that specific spectrum of light to have a better absorption in the body and a better effect, which is a key to any type of photodynamic therapy. So anyone who's using any kind of color at home or in clinical facilities or clinical settings, you will get a much better effect no matter what you're using a photosensitizer. And Andi, I think you can extend on that one too a little bit.
That was awesome. Crushing it. Right out the gates. Nurse Andi.
Cool. That pretty good.
So, in practice, I always think about, okay, what's this person having an issue with? So I think of things like, okay, my skin is blowing up. I've got some weird kind of infection or agitation or irritation. I know if I use my red light, I'm going to have antimicrobial, but I'm going to get more oxygen. I'm going to get more circulation. But I know that it's kind of hot and irritated. So then the blue, if you think about just like when you look at red, it's to kind of stimulate and move. When you look at blue, it's to kind of calm things down. So if I've got a hot tooth, I'm going to put a blue light on it. Versus it's already hot. I don't need more red. The red will kill it, but I combined the two together. And I think about green is right in the middle of our visual spectrum. So it's very balancing. It's very calms back to the normal of different things. And no matter what color you're using, I think we have to remember back to Krebs cycle. When we, so many of us don't breathe right, we're under oxygenated. And when you're under oxygenated, you kind of flip from using the Krebs cycle, which is how we make gasoline to run our cell, and we make 32 molecules. But when we don't have enough oxygen, we flip it over and we only make 8 molecules. So it's kind of like limping along on way less fuel to make everything run the way it's supposed to. So any kind of light therapy is going to balance that. And I think about it like sitting down at a piano. If you give all of the different wavelengths, the body takes what it needs. Because I can use my mind to go, well, I know this is studied and I know that is working. But the way that our individual internal mechanisms work, it's like the body will take what it needs and wants and it'll fix itself that way. So when in doubt, we give it all and have that, cumulative effect as well.
Yeah, there's a lot of exciting layers here. I mean, going back 100 plus years, we had chromotherapy where nurses and physicians at certain hospitals they found that by changing the color of the shades, it would affect the patient's recovery, red shades versus blue shades, having the sunlight shining through that. But we're going beyond chromotherapy. We're talking about a physiological effect that these different frequencies have in the body, especially when you apply them to these capillary dense areas like the nose and the wrist, the skull, or in the case of your intravenous light therapy device directly into the bloodstream. Who are some of the people that are using, and for those of you guys listening, if you want to check some of these products that we're discussing out, you can go to weberlaser.com. We have a biohacks discount code that'll save you some money if you end up deciding to invest in the Spectra watch like I'm wearing, or the helmet, or even finding a practitioner that's using the IV light therapy device. Contraption sounds like it was like Jimmy rigged, when it's actually quite an advanced piece of biohacking technology. Who are the type of people that are having the most success with your products, and which type of products do people use for to overcome which health challenges or to achieve certain health goals?
It kind of spans across the board, because light therapy doesn't really differentiate between whether you have an autoimmune issue, regenerative medicine, pain, chronic pain, or oncology, or something in the oncological field of cancer diagnosis, right? So that's kind of a very broad question, which we can get pretty deep into that. How deep down the rabbit hole you want to go here, Anthony?
Mm-hmm. I'm good to go as deep as we feel inspired to go. Right. And as long as our listeners, pack a lunch, let's go.
Do we want the blue or the red pill, right? So we can go down a very kind of deep spec on this one. I actually got into this whole field for personal health reasons, right? So it's ourselves specifically, we work with a clinic as well. And I actually work in a clinic and design programs and develop programs. And we work in clinical applications, clinical development, both for in-clinic applications and home care, as does Nurse Andi. And we are a team. We work with patients from many different modalities, right? And laser or light therapy has been one of the things that we have both seen made a huge impact in the effectiveness of any other treatment you're doing or any other application you're doing, because it will enhance the benefit of anything that you are already doing. It works as an integration and opens the pathways for a deeper effectiveness, per se. So we can go into this more from a woo-woo explanation or from a scientific explanation. So some of the things are some of the people that are working with it. We've got everywhere from acupuncturists to MDs to naturopaths in their own clinics utilizing the whole endo laser system, to everyday people, clinicians, to dietitians, to nutritionists, to patients who just want to feel better using some of the home care products. Even in clinical facilities, there's using home care products. And there's really not one diagnosis or issue that we've seen so far that it really can't help with. Years ago, I'll share a funny story that will kind of open us into another field, is we have seen effects everywhere from Lyme disease to Crohn's disease to autoimmune issues. We work with quite a few different types of cancers, everywhere from early stage to late stages. We've also worked with arthritis to patients who have hip problems, to shoulder issues, to just chronic pain, high blood pressure, headaches, sinus issues. Some people ask us, well, how can it work on so many different things? Well, because every light spectrum has a different effect on the body. When you combine them together, we have a different effect on the body. When you put red and green together, we create yellow light. So, again, everything we do, everything we create together has a different effect. So why can we work on so many different diagnoses or health issues? Is because we're giving energy back to the body, which is what essentially our body needs. And we can get very specific with that type of energy, per se, when we design those programs by specific light frequencies and light spectrums and nanometers and power, as well with photosensitizers and other integrative therapies as well. So I actually personally have dealt with Lyme disease and lupus myself, and a very long time ago, a cancer diagnosis. And not that long ago, I was on my way to a conference, funny enough, to join Dr. Weber, actually. And one of my legs swelled up, got purple, hard to the touch, cold, amazingly painful. I went in for a Doppler ultrasound, and there was a blood clot. And I was told I couldn't travel. It was a risk of a pulmonary embolism. So obviously I was looking at canceling, and my partner looked at me and said, well, why don't you use the laser watch on your leg rather than on your wrist? And of course, my reaction was, well, duh, right? Which is exactly right, Andy? I know. So sometimes we think of these things and we limit ourselves too. We think of a laser watch, using it on your wrist. Okay, well, it doesn't have to be always utilized on your wrist. It can be used in other areas of the body. So I use the laser watch with the pad that attaches to the watch over the area of the clot and behind the knee for around 3 to 4 days. The only other thing I used was some oral curcumin and some proteolytic enzymes. I went in for a Doppler ultrasound in that 3 days. And after those 3 days, the Doppler ultrasound showed an 80% increase in blood flow, which was amazing. That was unheard of from common knowledge of knowing how blood clots work. And we started doing additional studies on those things, looking at jugular vascular issues everywhere from MS to people who are having high blood pressure as well. Why was it working on the vascular system? So that was something that we didn't even realize at the time it was helping with. Understanding the science, we know it would. But I hope I'm answering your question, but to answer it a little more specifically, there's really not one thing that we haven't seen it work with. Lyme disease, it's amazing. But again, when you integrate it with other things, you get an even better effect. We've had people come in with high blood pressure, and we've been able to reduce it and get that balance with a matter of a few weeks, just using the laser watch, changing their diet, getting them some good supplements. Lifestyle changes, of course, as you know, are very important. So, I mean, that's an important aspect, I think, which you share with your listeners all the time.
Yeah. And I'm very excited about these unconventional applications of your own already unconventional and innovative products. Like we were talking when I was up at our lake house about, you guys had sort of piggybacked off some research showing that like riboflavin or riboflavin 5-phosphate is another photosensitizer. And with the COVID landscape right now, it's something where you can apply riboflavin nasal spray and oral throat spray combined with photodynamic therapy. And it has an antiviral effect that can protect people from COVID, or if they were to get it, possibly help as a part of their treatment protocol. Your story about the blood clot is fascinating. And Nurse Andi, you were talking about some of the work you've done with children and how we've seen light therapy when applied to the tibia can stimulate stem cell growth. Can you talk a little bit about how you've used photodynamic therapy to stimulate the tibia, using the watch and some other cool applications that you guys have had success with?
Definitely. I mean, so my background, I did a lot of German functional medicine. So I was usually injecting people, which was fine when I was working more with adults. But as I started working with more and more children don't like to be injected. And a lot of adults don't like to be injected either.
I was just thinking that.
So it was kind of one of those necessity is amazing. And so I knew that all the studies were basically using the interstitial, the endo laser, and placing it into the tissue, into the tibia directly. And I was like, there's no way we're going to be doing this in the clinic. So I just started working we had some kids that had failure to thrive. They weren't meeting their growth requirements. And I was like, hey, before we start doing growth hormone, let's just try this. And so basically I had the watch, and we use the helmet a lot also, but that's another story. So the watch I would actually put right on the tibia itself. And some kids didn't like the weight of it. So I would also go, okay, let's put the watch on one tibia and we'll take the nasal application and put it on the other tibia. And then after 10 minutes, we're going to switch. And so it was a way that we can kind of create an expectation of time with a limit that then we were actually treating both tibias simultaneously, but making it seem as though we were doing something different. and, you know, not needing to go into using some of the growth hormones and also with some of the folks that are, you know, some folks that I work with are very immunocompromised. And so it's like, hey, how can we get your T cell counts back up? And, you know, trying to obviously stimulate that bone marrow and it could be any long bone, but the tibia is the closest to the surface. And especially on smaller folks, it's the easiest to get the light in. You know, infrared is your more optimal light color because it's going to penetrate a little deeper. And so it's kind of combining both of those different areas and playing with it and seeing that result shift for folks.
So am I hearing you correct that the reason you chose the tibia as a location is because it's the easiest spot in the human body to get the light into the bone, which is what stimulates stem cells, or is there another reason?
Well, it's what most of the research was done on to do that treatment. And on children, it's so close that you're actually stimulating more bone marrow than you could anywhere else. Because if you think of it's the long bones and your femur's pretty well hid down in there, whereas the tibia is pretty much right up to the surface there. Yeah.
And, you know, what really sold me on light therapy a few years ago was I briefly mentioned the story about, you know, seeing my breath hold times go up by a minute plus. I'd also done a little bit of like using a pulse oximeter, like measuring my blood oxygen saturation before I would go in for IV light treatment and then after. And the first time in my life that I ever had 100% blood oxygen saturation, the first time that I'd ever measured it and seen 100 on the pulse oximeter. That's just for the listeners that aren't familiar. One of those little things, you can get them on Amazon if you were to search pulse oximeter for like $20 to $40, depending on the quality that you want to get. And it tells you your percentage of blood oxygen saturation in your pulse. The first time I ever got a 100 was immediately after intravenous light therapy. And I felt the difference too. I noticed a lot more energy and vitality. Let's talk a little bit about either any other out of the box applications that you guys are seeing. Cause like what's cool about the watch for those that haven't come to this conclusion on their own is you have different attachments. So you have much like the Vielight, there's like an intranasal attachment that goes into the nose and applies the light there. You also have the pad, which you mentioned, Jennifer, helped out with alongside the watch with your blood clot. And then there's another attachment, isn't there? I'm missing one, I feel like. The ears, yes. I haven't used that one yet, actually.
Oh, you got to try it. It's really fun.
This episode is also brought to you by Bioptimizers and the Biohacking Secrets Upgraded Digestion Package. So if any of you guys are dealing with suboptimal digestion, characterized by gas, bloating, your stomach feeling distended or like it's sticking out after certain meals, if you get sluggish, if you deal with constipation or diarrhea, you're going to want to pay attention because it usually comes down to one of three things being off. The first is low stomach acid production. The second is low enzyme production. And the third is gut dysbiosis, meaning you have too many of the quote unquote bad bugs in your gut and not enough of the good ones. And the Bioptimizers Biohacking Secrets Upgraded Digestion Package addresses all of these root causes of suboptimal digestion. It's the best value you could possibly get if you are looking to take 30 days and turn your digestion completely around. And you can get that for just $177. It's usually $270 by going to bioptimizers.com/biohacks. That's bioptimizers.com/BIOHACKS to check out the exclusive Biohacking Secrets Upgraded Digestion Package for just $177 today.
If you think about just your structure, as you're putting light, we always love to mix it with things. So whether you're putting a herbal spray up your nose or a homeopathic spray up your nose. And
we were talking about the Zen.
Exactly. So you spray Zen up in your nose and then you put the light into it. Not only is it going to help it disperse into the sinuses, but the way the pituitary sits on a very porous bone, the cruciform, it's going to actually stimulate that master hormone gland. And so it's phenomenal in being able to also work with the hormone balance, which for a lot of people is really kind of thrown off anymore with the stress levels. Mm-hmm. So it's a cool other way of using that nasal piece. And the other part, like with the ears, a lot of folks have tinnitus. And so by putting it in there, you're actually treating not just the outer ear, but the inner ear, because it goes through the tympanic membrane, which is also, clear for the most part. It's opaque, but the light gets through. So where you can't normally get to, you can get to with light. And it's a very powerful way of being able to move that along for folks.
It's really exciting, especially because more and more people, tinnitus, just for those of you guys that aren't familiar, is like ringing in the ears. And there's a lot of fancier descriptions, but with I've seen more and more people experiencing tinnitus, especially as we make these changes to our electromagnetic environment and roll out more and more, 3G to 4G to 5G. Yeah. It seems like more and more folks are experiencing tinnitus. There's definitely also a big stress component where even if it's not necessarily something related to the electromagnetic environment, it seems like when people are more and more stressed, particularly if they're stressed and have like a low level chronic viral infection like Epstein-Barr, we're seeing tinnitus in those cases. And so guys, if you're listening to this, or if you're familiar with any of Anthony Williams' work with the medical medium and Cleanse to Heal, he's a big believer that so many different health challenges are related to underlying chronic infections in the herpes family, like Epstein-Barr. And what we're also seeing that I would kind of say is a continuation of that is like compromised redox status. Like your body is in a state where you are losing voltage. So in order to, if you think of us more as like electromagnetic beings in nature, where the amount of electricity and electrons and photonic energy from light that's flowing through our body and using water and collagen as like superconductors to travel, if we have a lot of oxidative damage, oxidative stress from toxins, we mentioned certain things in our environment, like EMFs that can decrease our redox status, and these chronic infections, you could end up being in like a net loss of electrons. And by getting more sunlight, by utilizing photosensitizers to get the most out of the time that you're able to spend in the sun, because some of us have office jobs, less people today than maybe 6 months ago, but you use these photosensitizers to maximize your time and then stack them with sunlight and light therapy. You can start to, by capturing more of this photonic energy, increase your redox status, and then perhaps, depending on the recommendations of a functional medicine practitioner or whoever you're working with, stack that with like an antiviral or herbal antivirals to lower the pathogen. And it's like a 1-2 punch where you're seeing like the synergistic effect of multiple implements that are natural, non-invasive, and more effective than many of the tools that we've had at our disposal up until recently. No question there. I just kind of went on a rant, but I think this is all very exciting stuff.
That was good.
Let's talk a little bit about the helmet, because a lot of our listeners are interested in elite cognitive performance. And then also many listeners have family members, coworkers, loved ones who are dealing with neurodegenerative disease. We've got, like, in descending order, the leading causes of death in America are cancer, heart disease. I'm going to pause there for 1 second because it was Dr. Michael Twyman, who's a cardiologist, who is one that turned me on to your technology. And he's like, I wear it all day. I love it. He's like, I'm investing in the helmet too, so that we have that at our clinic and can use it. And then you've got neurodegenerative disease. So like, this is technology, which, yes, it could be helpful for cancer. That's just a little bit of a sensitive topic that, like, everyone's hesitant to say my stuff helps with cancer, because then you get people breathing down your neck. But you guys are also kind of knocking off the big three leading causes of death, which, like, if anyone listening is interested in longevity, you got to start by making sure you're not going to die from one of the leading causes of death before you're like, I want to live to be 150. First, don't die of cancer, heart disease, and neurodegenerative disease. How does your SpectraWatch, your intravenous light therapy device, and the helmet, can you kind of talk on how those help with cancer, heart disease, neurodegenerative disease?
I can jump in. I can have Andi take over. The one thing I was going to say is everywhere from the laser watch to the helmet to the large endo laser system from Weber, right? Where the endo laser system, for the listeners that aren't familiar, and I'm not sure, is the watch. We have those attachments we were just talking about, right? The nasal, the ear, the pad, and the watch. And you don't have to use them traditionally. You can use them in different places. The nasal applicator could be used on acupoints if you wanted to, right? The watch itself doesn't always have to be used on the wrist. You can use it on low back pain if you want deeper penetration. Helmet, we've seen so many different. Dr. Weber designed the helmet to have something that you could be used in clinic or at home for patients that had anywhere neurological issues to, memory issues, traumatic brain injury, Alzheimer's, Parkinson's. All we're doing is we're giving energy back to the body. So rather than saying, we treat these things, basically we're supporting the body and the immune system, right? So the large endo laser system that Dr. Weber designed has these amazing applications, from topical applications to intravenous to interstitial. So we can do an injection of PRP in a medical clinic into a joint and enhance the PRP, or some of the listeners, most of you probably know what PRP is, but it's when you take the blood, you spin it down into plasma rich. So it's platelet rich plasma per se, which is the proteins and factors of your blood, and the plasma that has all these growth factors. So many clinics are injecting that back into a joint or a painful area. And then we do laser therapy, specific colors of light to enhance that. So even in our own facility, we were seeing amazing results just by doing plasma injections. But then we started doing PRP with laser therapy injections, and the patients started getting a tremendous amount of increased benefit. So we had one patient of ours actually that was scheduled for hip replacement. And he was actually able to avoid a hip replacement from doing stem cell, plasma, and laser injection to the hip, which was amazing. We have sports injuries, right? So then we have people that can't go into medical clinics right now, COVID, right? So what we're looking at is we have these devices that you can use at home for those things. So if we have someone with cardiovascular disease, Lyme disease, any of these things, light therapy, you can design different protocols per se or programs for these people to use at home. So you can couple them with riboflavin, which works on the different pathogens to absorb. So basically what we're looking at with photodynamic therapy is we're looking at something that works on the mechanism of a photosensitizer, something basically that will work on the absorption of light into the body, right? It absorbs photons. So it's absorbs photons or the excitation of a photosensitizer into the bloodstream or into the body. Red and infrared will always penetrate much deeper because of the higher nanometer or wavelength of light. Mm-hmm. So if you're asking, Anthony, what would you see of working with cardiovascular, autoimmune issues? I think your question is specifically, right? How do you design those? Mm-hmm. I can tell you so many different patients and cases we've had from high blood pressure alone, just by doing the laser watch on the wrist and giving them specific photosensitizers. Memory issues, we do green tea extract, has shown to have effects with assisting memory issues and regenerative aspects. So we couple that with the infrared helmet. I think there's some amazing studies by a colleague of ours that was done over in South Africa. And Andi, we were just talking about that a little bit. If you could kind of share some of that, because I think it would be great. And she has one of the best explanations on this. Andi, can you take that one for us?
Yes, please. So with the brain, it's so interesting because we do a lot of quantitative EEGs. So we measure how the movement's happening, the waves are happening within the brain. And when you are using the red and the infrared, it's actually penetrating through the bone and into the brain itself. And Dr. Laporte did an interesting thing where he showed the QEEG, and the brain wave went from being dysregulated to actually stopping, which is unheard of. and then completely harmonizing out and going into the pattern that we are shooting for when we're doing neurofeedback, when we're doing re-entrainment. And I see that a lot in clinic as well, because folks, our brains are mostly, fat tissue that is conducting and sharing information. But if we start having nests of viruses, which love that tissue, or we start having toxic metals, which is a lot of the buildup we'll see in different kinds of neurodegenerative diseases. If we can apply the photosensitizers along with the light, it has both antimicrobial, but it's also enhancing the circulation, it's enhancing the conduction. So all of a sudden, folks that are perhaps nonverbal or who've had cognitive decline or have had brain fog start seeing and experiencing their brains coming back to what it used to be.
Are you guys seeing, oh, sorry. My apologies.
It's okay, please.
Are you guys seeing these help people that have where their brain is working properly, but they want to improve performance? Or is it more that people come to you because their brain isn't working properly? Their experience, the pain motivates them rather than like, I want to see if this thing can help me find that next level.
Oh, absolutely. People that don't particularly have any specific issue or diagnosis of any kind, many of them call us and they're looking just to improve their brain capability, the way they think. Also preventative medicine. We know that, as Andy was saying, that, infrared light can penetrate much deeper and through bone. So just using the transcranial LED helmet every day is going to affect the neuron growth and the neuron production, right? So just from that, you're going to get an enhanced benefit of, you know what? If I were to use it, probably we'd have more articulation with people. If Joe next to me would use it, they would have more articulation. So you're also increasing vascularity as well. You're reducing inflammation. And this day and age, most of us getting into the biohacking thing are using cell phones, and cell phones right now have all these 5G, right? So it's also a way to kind of help protect your body a little bit and reduce inflammatory process as well. So Andy and I have actually been talking about this just as a preventative measure. It would be excellent for people. And one other thing is, a lot of people right now with the whole COVID situation can't get into clinics, or they don't want to go into a clinic per se. So in some of the cultures in Asia, they developed for cardiovascular disease these infrared and red lights that would go in the nose, right? Mm-hmm. Because some of the blood vessels were much smaller and you had these little blood vessels in the nasal area. So you could get some irradiation that way of the actual blood vessels and through the systemic vascular system. So we have a lot of people that end up with helmets and watches, and they're just doing all these home treatments by doing transcranial applications, which is the helmet. And then they're doing these intranasal applications using the laser watch. So they're getting some of those. And we're even getting report of seasonal allergies. Tinnitus is another one that we're seeing a lot of patients just report, hey, you know what? I've noticed that the tinnitus I've been using it every day for 3 months, and suddenly the tinnitus is 50, 60, 70, 80% improved. So there's a lot of these little things that even surprise us sometimes. And that's been through some of these years that we've just seen these things happen.
Yeah, it's really exciting to think about being able to, a huge part of what our listeners are interested in is just taking control and having control of your health. And not feeling like you need to outsource it. And like, it's super exciting to think about tinnitus, something that's traditionally difficult to treat, or maybe like a huge part of it is environmental, but not everyone has the option of making dramatic changes to their environment. But you could stack certain polyphenols with your intra-ear light therapy from attachment from the watch, and like take something like, we know polyphenols help. We know that increasing your antioxidant status by eating more fruits and vegetables and, fresh juicing with a non-centrifugal juicer, you stack those things with what you guys are seeing working with the intra-ear photodynamic therapy. And like, you get a synergistic effect where it's like 1 + 1 = 3. Let's talk a little bit about some of the protocols that you guys are using. Different, whether we're talking about someone that has maybe blockages, cardiovascular blockages, or autism or neurodegenerative disease. I remember with the UVLRX, when it was there, I think they used to say like 20 treatments in roughly like, I think it was like roughly like a 3-week or a 30-day time period. You want to do like 20 treatments in 30 days for Lyme disease and like chronic infections. What are some of the protocols that you guys have had success with based on the specific desired outcome?
Well, if we're looking at Lyme disease, for example, and I think Andy can chime in on this one too. Andy, if you've got an idea, just kind of interrupt there, put your little hand up. With Lyme disease in our own facilities and some of the other clinics we're working with, it depends on, if it's chronic, acute, and how much advanced they are, right? But we've got a few cases I can explain pretty easily. So with Lyme disease, and it was initially doing pretty much intravenous red light. And I don't know if most people are familiar, most of the listeners, I would think, to the UVRLX system, which was an amazing system. But
maybe, I don't know.
Maybe not. So kind of explain this a little bit, right? So yeah. The Weber device is a way that you do, just like an IV line. Usually you'll put in an IV catheter, right? And that catheter goes into the vein. It's a piece of plastic per se that it stays in the vein, and these IV solutions in your office get applied in a medical office. Well, the IV of the intravenous laser was this very advanced, very neat fiber optic sterile line that goes through that catheter. So you will get irradiation of the laser directly to the vein. So when you're looking at your arm, it looks kind of Star Trek-y, to be quite honest to our listeners, that you'll see this kind of glowing under the skin per se. It doesn't hurt. It's painless. As a matter of fact, it's quite fun to watch. Mm-hmm. And most people will feel this calming sensation. So just kind of explaining that, you have this Ender laser system with all these different specific diodes. You have red, green, blue, infrared. You have specific wattage output of those diodes, and you have different color output. And there's this fiber optic line that connects from the diode directly to your intravenous application. And so just so that some of the listeners understand how that works, it's intravenous laser therapy. Then you have topical as well. So we're talking about intravenous. So with these Lyme patients, including myself, because I got into this again because of my own health and a family member who was sick, and doing intravenous applications, most of the protocols were using red, blue, and ultraviolet in the beginning. But then we started seeing some of these patients. What's the biggest problem we see with Lyme disease? The Herx reactions, right? The herxing, the detox, that horrible sensation that most of us Lymies get. So we started doing yellow laser with those patients because we knew that it was increasing serotonin, dopamine, vitamin D uptake. But we also saw these different studies that were done through the years of opening detox pathways and supporting the detox pathways. So we went into the whole science background of this, but understanding that most Herx reactions where we had an overload of toxins in our body or a lack of production of energy to detoxify, we started doing longer periods of intravenous yellow light. And that's when we started to see an even better outcome with Lyme patients. We also would integrate things like artesunate or riboflavin or curcumin in combination with those specific wavelengths that would match up. So riboflavin, let's just talk riboflavin, was a very, antiviral, right? So we'd match riboflavin that would match specifically with blue and ultraviolet. That was the main one. So we would do a series of anywhere 5 up to 20 sessions of intravenous light therapy. And we would integrate that with very specific intravenous photosensitizers and or oral. And then most of these patients were doing other treatments too, whether it was ozone therapy, nutrition, stem cells, whatever it might be. One of the most amazing cases was a 25-year-old dancer that ended up coming in a wheelchair. She was unable to walk. And it was quite sad because it was her passion was to dance. And as most of us Lymies know, a lot of those things are taken away from us. And most of us are told that there's nothing you can do and they don't know what's wrong with you. Well, she arrived to our clinical facility in a wheelchair and was having seizures every 5 to 30 minutes. She was on at least 22 different medications at this point. We did a 3-week program with her, 5 days a week. Saturdays we did some things, but mainly 5 days a week. After week number 1, she was off about 50% of the medications. About midway through week number 2, she was getting up out of the chair on her own. walking with a cane and some support, but it was amazing. And we did transcranial as well with her as in addition to intravenous because of the neurological aspects and some of the spinal compression that she had. And on week number 3, she was up dancing. And we've got pictures and videos, and now she's had a young little girl and she's living her life. So of course it's always an integration, right? But it's a heartwarming story to see this. I'm one of the ones too that's done this, but again, it's always an integration. During this whole COVID period of time, there have been quite a few of our own colleagues that have been, unfortunately and fortunately, they've had patients come in test positive for COVID. So we designed a protocol to assist with treating COVID, which included riboflavin with ultraviolet and blue specifically. And ultraviolet and blue specifically with COVID, we started seeing within about a 5-day period, the viral counts go down, white blood cells back into normal range, oxygen saturation improved from the 80s to low 90s up to 98, 99. And most of the symptoms were gone within about 5 days. Now, again, it always depends on how advanced or how chronic or how acute these things are, right? Epstein-Barr is one that we're actually doing a study with right now that we're seeing the reduction Epstein-Barr. I can tell you also an HIV study, which is kind of controversial, but it was amazing to see that just by doing ultraviolet laser with blue and using riboflavin in that case as well, it's one of the easiest things to use, so that's one of the ones we were using. Within about a 2-week period, we had viral counts go back into normal range, and we did do this every day, but we had viral counts on these patients go back into normal range, and their viral loads reduced to, they were still detected because the antigens were there, but their viral load counts were below, normal range by our lab standards were below 40, and they were below like 22. It was amazing. So, and we have all these record statistics. It was just, it was kind of mind-boggling at the time.
It's pretty exciting, especially because I've seen how difficult it can be. We've had a number of patients who in the past couple of years are testing high for Epstein-Barr. And we know that Epstein-Barr and some of these viral pathogens are connected to like chronic fatigue. And it's very difficult to lower with just antiviral herbs like licorice or St. John's wort. And typically you either need to go to like an antiviral like a valacyclovir, or it's hearing that you can use light therapy either as a standalone treatment or as a part of a treatment is pretty exciting.
Well, what Photodynamic thing does is technically, let's say it can destroy the microorganisms of the viruses, right, and viruses. So that's what it's kind of doing with viral, which is why with the Lyme disease, we started integrating the yellow light as well because of the detox pathways and the Herx reaction. So you're absolutely right, Anthony. I would probably say, and I think Andy's seen the same thing, we have an amazing team of physicians all through the United States, Canada, Europe, and most of us are trying to keep this network going of sharing research and sharing how we're using laser therapy in integration with all these different applications. So oncology is an amazing field, but you're right, it's one of those things that's a bit more sensitive. But when we go into Epstein-Barr, I will tell you every patient we have treated, we check for Epstein-Barr virus and all the viral counts. And interestingly enough, across the board, we have acute and chronic come back positive, and those numbers, full panels, are positive. It is a very interesting, whether it's Lyme disease, lupus, cancer, cardiovascular disease, every single time we see Epstein-Barr positive in these patients. So it's something that I think all of us as a team need to look at more because it's very important. And like you said, herbs alone don't always do it. Our body needs more assistance, and laser therapy, light therapy can be that.
I'm thinking more and more that imbalances in our light environment, particularly like high amounts of blue that can suppress melatonin and have a negative effect on our mitochondria, combined with a lack of sunlight, have created almost like this downstream domino effect of, weakening our immune system, opening us up to some of these chronic infections, chronic fatigue, and compromising our body's ability to detox. And like almost, it's not just It's not just that like we need more light, you know, and getting outside, but we need the right spectrums and frequencies of light to like restore homeostasis in the body.
And combinations, like you're saying, the integration. You can get very specific on matching an herb or a medication with a specific wavelength or frequency of light. And that, I think, is one thing that Dr. Weber and the whole team has been really advanced or imperative in finding, is the integration of photosensitizers with photodynamic therapy. It really is a revolutionary field. It's something that most of the community wasn't looking at for many years. It's common knowledge. You can go into Google and type in, you know, green tea extract. What's the photosensitization? Andy and I were having a conversation with this brilliant scientist in Germany that we work with, who's created a nanoparticle form of indocyanine green, which is something we've been using in oncology, you know, over in Germany.
I heard you mentioned that earlier, and I was going to ask.
Yeah, it's really interesting because most of us are familiar with methylene blue, right?
I have some here.
There you go. Me too.
This episode of the Biohacking Secrets Show is brought to you by Veritas Farms and their full line of CBD products, CBD standing for cannabidiol. Now, we are real excited about this partnership because Veritas means truth in Latin, and we are big believers in bringing you guys the truth, not just through this podcast, but by making sure that any products that we share or that we bring on as sponsors are products that we personally use, believe in, and endorse ourselves. And that is the case with Veritas Farms and their full line of CBD products. The reason that they're so great, they are full spectrum hemp products, meaning that they have all of the beneficial phytonutrients that you get in a quality CBD product. 99% of the CBD products on the market are CBD isolate, and they're just being resold, meaning they're coming from a few small manufacturers. They've only got one tiny part of all of the important phytonutrients that you need to get the benefits you want from a CBD product, and they're just a bunch of different companies reselling them. Veritas Farms is vertically integrated, meaning they own the farm. They ensure that there are no pesticides being added. It's organic, and then they control the entire process from harvesting to extraction until that product ends up at your door. That's what I love it. It's kind of like farm to table, but for CBD. And the benefits that I've noticed, my sleep is better. I feel like I get a deeper, more restful night's sleep. I'm less stressed. I never have periods of anxiety. I feel calm and focused throughout the day. And it even decreases inflammation when I have flights or other things where inflammation is an inevitable part of life. You take a little extra CBD and it can be very helpful for stress, anxiety, sleep, and that inflammation. So if you guys want to check it out, we've arranged a 15% discount for you guys. To get that, you can go to theveritasfarms.com/biohacks. I'll spell it out. THEVERITASFARMS.com/BIOHACKS to save 15%. Check out the Veritas Farms CBD. You guys are going to absolutely love it.
So, you know, we have nano-ICG it was used for, just like methylene blue, for pigmentating in laboratories with different malignant cells and different types of viral cells as well. And very interestingly enough, there's a scientist in Germany that we work with that created a nanoparticle form. And Dr. Weber started utilizing this by injecting to tumors, both intravenously and directly to tumors. Well, what we started seeing is we would see that it was specific wavelength of light was absorbed by infrared. So suddenly we started seeing these necrotic, these tumors turn completely necrotic. The necrosis factor was just impressive, and the tumors would start dying away. So we have so much information on nano-ICG, but it's a very interesting compound. It's a very simple compound, but the science behind it is quite brilliant.
And it's essentially smaller particles than regular green tea, so it's probably able to get to places that regular green tea cannot.
Well, green tea is very no. You're on the right path, but green tea is very different than indocyanine green. It's a completely different spectrum. And actually, Andy, can you take that one a little bit on the green tea one, because I'm going to bring up one of the little notes on nano-ICG so we can share that with.
Yeah, and where could our listeners, like if they wanted to start using specifically like the nano-ICG, where could they start? Where could they get a good oral nano-ICG to combine with their photodynamic therapy?
Well, we work with a a pharmacy in Germany that actually creates it. So on the Weber website, you can order it, and it has a very specific mechanism of using of fat molecules so that it can shuttle it into the cell, because if, a lot of times we've heard of lipophilic, and you need to have that extra molecule to get inside of the cell and work that more effectively for things.
Is it safe to say it's like a liposomal green tea?
No, it's technically, sorry, Andy, it's a fluorescent dye actually that was used in medical diagnostics.
Okay.
And it was usually used for determining cardiac output, hepatic function, liver blood flow. It was used. It was actually developed by Kodak Research Labs and got FDA approval in 1956. Do you believe this? 1956. But the issue was it was a peak spectral absorption in about the 800 nanometer range, which is why it was more in that infrared range, right?
Right.
So it's different than green tea extract.
And it has nothing to do with green tea.
No.
Okay.
It's very different. It's very.
I don't know why I was really chomping down on that one.
Because it's green.
It's green. I'm just like, it's green tea. No, stop saying green.
The ECGC, the ECGC part, the other. Is
also a photosensitizer.
Yes.
Okay, so we're talking about two photosensitizers. One is nano ICG, one is green tea. Different things. I got you. Two photosensitizers for the price of one. But wait,
there you go.
That's not all.
Okay. Well, and as Andy was saying, there's if people want more information on this, we have so many articles, presentations. They can go to, the email and just send us a request, and we're happy to share it. This information is not something we want to hoard. We want people to know. It's knowledge, it's education. Like you said, people need to understand and hold health in their own hands. And, the medical community out there too, we want to help them educate and train, and our own protocols, we want to share that with them. And people who want to be involved with us and learn and educate and organize these protocols and develop them with us. There's the International Society of Laser Therapy Application, and it's now been formed in the United States, which is the North American Society, so that we can educate no matter what. And this is what I love about Dr. Weber and the team. No matter what laser you have or light therapy, we want the education out there. The Weber devices are so advanced. I mean, come on, they're Germans. They're amazing, right? I mean, they come up with the best technology. And
they really do.
Dr. Weber's, they really do. And I love working with them and being partners with them because, and Andy as well, because we've both seen that they want the education out there. And Dr. Weber, that's what he wants. He's always coming up with something new. When I first started working with the equipment in our own clinic, ultraviolet and yellow light, or the lasers, were not even available yet.
Yeah.
So believe me, there's always something new. So we're happy to share that information. But as she was saying, the nano ICG is something we're happy to send, the information out about it. But you can look up on Google. You can look up in Google and put in green tea extract. What is the spectral absorption? And it will show you. The most common is kind of in that ultraviolet spectrum, but it does have others too.
Do these studies, are you able to back into the proper dosage in order to maximize the photosensitizing effect? Because like green, let's say curcumin, for example, if we have someone that's dealing with extreme inflammation, their dosage may be 1,800 milligrams of like an integrative therapeutics theracurmin. Is it the same dosage for photosensitizing, or is it different? And how would someone go about figuring out the proper dosage to optimize their body's capacity to capture photonic energy?
Very good question. There's actually two products that Dr. Weber had formulated for people to be able to utilize either in clinic or at home. And they're two supplements. One is called Photoactive, and the other one is called curcumin. It's a curcumin pro. So it is a very specific form of both liposomal and combination of phytophorins on the Photoactive. The Photoactive is probably one of the more broad spectrum because it has light absorptions because of the different ingredients kind of across the board, except maybe for infrared, but it will absorb all other colors. And the curcumin is, again, specific wavelengths. So when they're asking for, what doses for each individual person for maximum absorption of light, We do have some information we can share on that. And as a matter of fact,
just get the Photoactive and be done with it.
Well, Photoactive and the curcumin are probably the easiest. You can use other supplements, of course. You can get a water-soluble or a liposomal form, let's say, of curcumin, or a water-soluble form of chlorophyll. But again, products, quality of products. I mean, we Andy and I are working with a patient right now that went to the local pharmacy and bought a curcumin bottle and called us and said, she called me first and said, I just don't feel the difference with this. So she sent a picture of the bottle. And of course, it was full of gluten and fillers and all kinds of things because they didn't read the label. So, we said, you don't have to get this particular product from Weber Medical, but you could, or you can go get a higher quality, like, the different curcumins that all of us work with. Right. There's so many different ones that are very good quality. As far as the dosing, that is something that actually we're trying to give some educational articles right now and write-ups about what the proper dosing might be, depending on the products. But the easiest would be, the Photoactive, like you said, and be done with it, or the curcumin that they've developed, because it's specific for use with those wavelengths. However, we're trying to actually create kind of a chart on what the most common dosaging compared to what wavelengths would be the most effective. But every patient's going to be a little different. And
do you guys have somewhere where people can find out, like, if they want to do some of the treatments of your intravenous light therapy, do you have somewhere where they can find out what practitioners by them have your machine? So they could book appointments with that person and go get it. Cause that was one of the things, I was so bummed out when I couldn't get the UVLRX anymore. And then, when I found out that you guys had a similar technology, I was like, I want to get back doing that. I felt great when I was doing it. How would a listener go about finding out where they could get intravenous light therapy or photodynamic therapy with the Weber laser?
Well, right now, if they want to send an email to the info@weberlaser.com, we can go ahead and give them, they can tell us where they're located and we'll support them with that. Right now, we're actually updating the websites. Due to COVID, we're having to redo this because unfortunately, some of our friends and colleagues have closed their doors or are no longer available. So what we're doing right now is creating exactly that, a database of all physicians and practices that are doing the intravenous and have a laser therapy and have the endo laser systems, so that we can have a referral source for patients and physicians looking that they want to visit a clinic or go get the treatment. So yes, huge. We will have that. It's very important.
It is. And guys, if you're listening and you're excited about companies doing innovative work and empowering us, to be able to take our physical and mental performance into our own hands, vote with your dollars by supporting these companies. Pick up a laser watch if you have the capacity to invest right now and start doing some of these treatments at home. Pick up their their transcranial photodynamic therapy helmet. Or if you're dealing with Lyme or a chronic issue and you feel like you'd like to explore intravenous light therapy, go to weberlaser.com. You can enter discount code biohacks to pick this stuff up. Or as they mentioned, you can go to info@weberlaser.com and let them know where you live in the world. And they'll be able to point you to a practitioner, the closest practitioner that is using their technology, so you can book some appointments. And just before we I want to kind of bring it home and be respectful of both your time. But before we do that, guys, if you haven't already listened to episode 3 of the Biohacking Secrets Show with neurosurgeon Dr. Jack Cruz, it's one of our most listened to episodes. And it was recorded in 2016, right before they released a product called the Quantlet. The Quantlet, as this may sound familiar, it was a light therapy device that went on the wrist, on the radial and ulnar arteries. And I was incredibly excited about it. You'll hear in the episode some of the exciting research behind that technology. Unfortunately, they had some bugs and the technology was not German built. And it ended up not really taking off the way that they had expected. I had one, it didn't work for me. The Spectra Watch is that technology. So if you want to dig into this a little bit more and you're excited about the arena of photodynamic therapy, listen to episode 3 with Dr. Jack Cruz. And if you want that technology, it is now in the Weber Medical Spectra Watch. And we've got that discount for you guys. Jennifer and Andy, what else do you want to share with our listeners in this area? And what do you feel needs to be put out into the world right now?
I've got a couple, but Andy, why don't I let you go first, please, dear?
Well, what I love about some of this therapy is just how easy it is to do yourself at home, and that it's cumulative. So if I at home do this 3 or 4 times, when I go to the doctor on that 5th or 6th time, it's going to be exponentially stronger. And I teach families how to use this. And what's kind of nice is that one unit works for the whole family. And so we share. It's a powerful tool. And I'm a firm believer in, I want you to learn to fish. I will happily feed you fish, but if I could teach you how to fish, I'm even more excited when I hear that you taught your neighbor how to fish. Mm-hmm. And so this is like, all of us are so smart together. And the more we can share of this data, and the more we can support each other in finding these hacks that make us all feel better, function better, tolerate reality better, I'm all for it all the time. And I just want to say thank you so much for giving us this platform to share this information with you guys at. And we look forward to doing a lot more in the future.
Absolutely. Thank you. I've had a great time during our conversation. It's been a blast.
No, and thank you, Anthony, for having us with you, because it's a pleasure. And I think there's more people that need to learn about this. I will make this as fast as I can, but I think it's one thing I want to leave the listeners with, and with you, as Andy said, is that technology is easy to use. It's not difficult. We need to think outside the box, as most of us do, because we get these devices for home use, no matter what it might be, a laser watch, a helmet, an infrared pad, whatever it might be, an ozone machine, a sauna. And we seem to get limited in what most people are thinking on how to use those things, if I'm explaining myself well. Meaning that if we get a laser watch, think outside the box. We don't want the listeners to feel they're alone. We're here to support them, guide them on how we've used them, give suggestions on how we've done, because we have people that are using nasal applicators in unusual ways to help with infections. We have patients that are using the watch itself in different parts of the body, helmets being applied differently. The one thing I have to say about the helmet is that it has this amazing frequency box that you can program in frequencies to now as well, which is kind of a new part of that. I think a lot of us get very desperate. A lot of us get very scared. I know I did when I went through this, when I first got sick. And I had a very sick family member, and I actually was not originally in medicine. I was actually involved in music. And I love that field, and I wouldn't change it for the world, being involved in this now. And running and working with a clinic out of country, working with a health organization in the United States to educate people, working with people like yourself, Anthony and Andy. We want to empower people that use these things at home, and as well as our medical professional colleagues, to support them as well, because this is a community. There are a lot of people that are sick out there that need help, and we want to be there to support them. And the Weber technology is one aspect that is so easy to use and yet so medically advanced that you can get such amazing results with it.
Well, thank you so much for the work that you guys are doing. And, I'm incredibly excited about it. I can't wait to try the helmet and demo it with my dad and see how it affects his Parkinson's. And guys, if you enjoy these types of innovations in the biohacking space, vote with your dollars. Go to weberlaser.com, pick up the Spectra watch or the helmet or both. And if you enter discount code BIOHACKS, BIOHACKS, that'll save you some dough. I appreciate Jennifer and Nurse Andi, both of you coming on and sharing your wisdom, and we'll have to do it again soon.
What's up, guys? Anthony here, and thank you so much for listening to this episode of the Biohacking Secrets Show. One of my favorite things to do is helping men and women like you feel what it's like with the body you've always wanted and all-day energy that starts the moment you wake up and doesn't quit. Over the past decade, we've created a proprietary health assessment that helps me to identify the unique toxicities and deficiencies that may be holding you back from the life that you deserve. And what we've discovered in doing this with now thousands of CEOs, executives, professional athletes, businessmen, Hollywood celebrities, and entrepreneurs is that there's always room for improvement and optimization. Whether you're already performing at a high level or you have that feeling inside your heart that you're capable of more, the single fastest way to unlock your potential is to upgrade your mind and your body. And there's no program on earth that does that faster or to a greater magnitude than our one-on-one consulting program at www.biohackingsecrets.com/coaching. We start with our proprietary health assessment that screens you for vitamin deficiencies like A, D, magnesium, iron, etc., high cholesterol and heart disease, high blood pressure, digestive disorders, hidden infections like Lyme, Epstein-Barr, parasites, SIBO, Candida, and more that can just drain your energy in the background, especially if you don't know about them. Anxiety, depression, and cognitive disorders, autoimmune disease, adrenal fatigue, thyroid issues, mold toxicity, heavy metals, environmental toxins, and other genetic risk factors like MTHFR, APOE status, your glutathione production, and many more. We even recommend the specific tests that I use with my one-on-one clients if they're relevant for you in figuring out your biological age and identifying those key areas and opportunities that can take your life to the next level. From there, we create a customized game plan along with a personalized supplement protocol to help you optimize your weight and energy at the cellular level. And for our platinum clients, we even include a personalized workshop with me in Delray Beach, Florida. Most of the year, this program's full with a waiting list, but we just had a couple spots open up and I wanted to offer them to the listeners of the Biohacking Secrets show first. So if you're interested in seeing what it might look like for us to work together, head over to www.biohackingsecrets.com/coaching. That's www.biohackingsecrets.com/COACHING and fill out the short application form. If you're pre-approved, you'll be given the opportunity to book a time to connect with someone on our team and see if it's a fit. Thank you so much for being a part of this community, and I look forward to potentially going on this journey together.